Action.
Okay, hi, my name is Taylor. I'm a student physical therapist. Today I have Natalie with me. She's a 22-year-old college softball athlete. She plays in the outfield, and she came to me because she's having some posterior shoulder pain in her left arm. And she realized this pain after she dove for the game-winning ball. She caught the third out in the 7th inning, and they won the game. It was tight, wasn't it? It was like 1-2, yeah. And how did you dive and catch it? Like that, and then you landed on your shoulder? Okay. So because of the way she landed and her pain in her posterior shoulder and the way she expressed to me earlier that at practice now for the past few days, she's been in pain and felt unstable when she's reaching out to catch a ball and when she's reaching up to catch a ball above her head. And so I think you might have some posterior instability in that shoulder, which would have been due to damage of that posterior glenohumeral ligament when she dove. So because I think this, we're gonna do a special test called the posterior jerk test, and a positive of this test, I'll let you take your shirt off and I'll explain, would be if you have pain or there's a clunking, popping in that shoulder, that might mean we have some posterior instability, okay? So I'm just gonna put my hand right here, take this on. Okay, I'll add some pressure, and then you just tell me if something feels a little off, painful, like it's gonna pop, like it does pop. It's already popped.
It's starting to hurt.
It's hurt, okay. Well, that was a positive then, because it hurt and you had that pop, okay? So we'll say that, I'm pretty sure she might have some posterior instability, okay? So now we're gonna do a joint move of her shoulder. We're gonna do an inferior joint move. Go ahead and lay down for me. I'm gonna do inferior because she's having problems reaching away from her body and abducting and flexing over her head with catching. This will help with that, and it'll also help with some of that pain inhibition. So first, let's do some joint play in that shoulder to kind of loosen it up, make sure we're not just cranking away. Does that feel okay? We would do this for a few minutes, just make sure she's relaxed and everything gets loosened up. Just maybe 2 to 3 minutes. Does this feel okay? Okay, good. Okay, so now we'll move on to our posterior move. We'll just be pushing our force down a little bit, down and lateral. We're gonna do a grade 2 because she's having that pain, so that'll help there. And we'll do this for 3 to 5 minutes if you can tolerate it. On and off for 30 seconds maybe. Okay, and there we go. So thank you.